NOBA article on ADHD and behavior driven by Richard Milich and Walter Roberts of the University of Kentucky continued. I'm going to continue from section that begins titled Parent Management Training. Parenting children with ADHD can be challenging. Parents of these children are understandably frustrated about by their children's misbehavior. Standard discipline tactics such as warnings and privilege removal can feel ineffective for children with ADHD. This often leads to ineffective parenting such as yelling or ridiculing the child with ADHD. This cycle can leave parents feeling hopeless and children with ADHD feeling alienated from their family. Fortunately, parents management training can provide parents with a number of tools to cope with and effectively manage their child's impulsive and oppositional behavior. Parents management training teaches parents to use immediate, consistent, and powerful consequences because children with ADHD respond well to those types of behavioral contingencies. Other, more intensive psychosocial treatments can use similar behavioral principles in summer camps-based settings, and school-based intervention programs are becoming more popular. A description of a school-based intervention program for ADHD is described in focus topic number 3. What works best? The multi-module treatment study. Recently, a large-scale study, the multi-module treatment study, MTA, of children with ADHD compared pharmacological and behavioral treatments of ADHD. This study compared the outcomes of children with ADHD in 4 different treatment conditions, including standard community care, intensive behavioral treatment, stimulant medication management, and the combination of intensive behavioral treatments and stimulant medication. And combined treatment was no more effective than stimulant medication alone. Behavioral treatment was advantaged in other ways. However, for example, children who received combined treatments were less disruptive at school than children receiving stimulant medications alone. Other studies have found that children who receive behavioral treatments require lower doses of stimulant medications to achieve desired outcomes. This is important because children are better able to tolerate lower doses of stimulant medication. Further, parents report being more satisfied with treatment when behavioral management is included as a component in the program. In sum, stimulant medication and behavioral treatments each have advantages and disadvantages that complements the other, and the best outcomes likely occur when both forms of treatments are used to improve children's behavior. The future of ADHD. It is difficult to predict the future. However, based on trends in research and public discourse, we can predict how the field may change in time as time progresses. This section will discuss 2 areas of research and public policy that will shape how we understand and treat ADHD in coming decades. Controlling access to stimulant medication. It is no secret that many of the drugs used to treat ADHD are popular drugs of abuse among high school and college students, and this problem seems to be getting worse. The rates of illicit stimulant use have steadily risen over the past several decades, and it is probably not a coincidence that prescription rates for stimulant medications have increased during the same time period. Students who abuse stimulants often report doing so because they act as an academic performance enhancer by boosting alertness and concentration. Although they may enhance performance in short term, non-medical use of these drugs can lead to dependence and other adverse health consequences, especially when taken in ways other than prescribed. Stimulants can be particularly dangerous when they are taken without supervision from a physician, because this may lead to adverse drug interactions or side effects. Because this increase in prescription stimulant abuse represents a threat to public health, an important goal for policymakers will be to reduce the availability of prescription stimulants to those who would use them for non-medical reasons. One of the first steps for addressing prescription stimulant abuse will be understanding how illicit users gain access to medication. Probably the most common method of obtaining stimulants is through drug diversion. The majority of college students who abuse stimulants report obtaining them from peers with valid prescriptions. Another way that would be abusers may gain access to medications by malingering symptoms of ADHD. These individuals will knowingly exaggerate their symptoms to a physician in order to obtain a prescription. Other sources of illicit prescription drugs have been identified, but more research is needed to understand how much these sources contribute to the problem. As we gain an understanding of how people gain access to illicit medication, policymakers and researchers can make efforts to curtail the rate of stimulant misuse. For example, because drug diversion is a major source of illicit stimulants, policymakers have enacted prescription monitoring programs to keep track of patients' prescriptions seeking behavior. And in some cases, patients are required to pass drug screens before receiving their prescriptions. To address malingering, researchers are working to develop psychological tests that can identify individuals who are faking symptoms. Finally, pharmacologists are working to develop stimulant medications that do not carry the same risk of abuse as the current available drugs. Although all of these measures will reduce illicit users' access to stimulant medication, it is important to consider how the policies will affect access among people who need these medications to treat their ADHD symptoms. Prescription tracking programs may reduce physicians' willingness to prescribe stimulants out of fear of being investigated by law enforcement. Patients with ADHD with comorbid substance abuse problems may be denied access to stimulant medications because they are considered high risk for drug diversion. Similarly, lengthy psychological evaluations to assess for malingering and mandated drug screening may be prohibitively expensive for less affluent individuals with ADHD. These measures to reduce illicit drug use are necessary from a public health perspective, but as we move forward and enact policies to reduce stimulant abuse, it will be equally important to consider impact of such legislation on patients' access to treatment. The role of neuroscience and behavioral genetics in understanding ADHD. Much of the research on ADHD has been conducted to answer several deceptively complex questions. What causes ADHD? How are people with ADHD different from their typically developing peers? How can ADHD be prevented or treated? Historically, our tools for answering these questions was limited to observing outward human behavior, and our ability to ask questions about the psychology of ADHD was severely limited by the technology of the time. In the past 2 decades, however, rapid advances in technology, magnetic resonance imaging, genetic analysis, have allowed us to probe the psychological basis of human behavior. An exciting application of this technology is that we are able to extend our understanding of ADHD beyond basic behavior. We are learning about the underlying neuropsychological psychology and genetics of the disorder. As we gain a fuller understanding of ADHD, we may be able to apply this knowledge to improve prevention and treatment of this disorder. Knowledge of the underlying psychology of ADHD may guide efforts to develop new non-stimulant medications, which may not carry the side effects or abuse potential of traditional stimulants. Similarly, these advances may improve our ability to diagnose ADHD. Although it is extremely unlikely that a perfectly accurate genetic or neuroimaging test for ADHD will ever be developed. Such procedures can be used in conjunction with behavioral evaluation and questionnaires to improve diagnostics accuracy. Finally, identifying genetics traits that predispose children to develop ADHD may allow physicians to use targeted prevention programs that could reduce the chances that children at risk for developing the disorder will experience symptoms.